Hello, everyone, and thank you for joining us tonight for Arthritis Talks, Arthritis Pain, and Medical Cannabis. I'm Dr. Sean Bevan, Chief Science Officer at Arthritis Society Canada. We've come together for this event from many different places, but I would like to first acknowledge the land on which I am located on and on which our Toronto office stands, and that is the traditional territories of the Mississauga of the Credit First Nation, Anishinaabeg, Huron-Wendat, and Haudenosaunee Indigenous peoples. Today, this meeting place is home to many First Nations, Inuit, and Métis people, and I am so grateful to have the opportunity to live with my family and work on this land. Now, cannabis for medical purposes has been legal in Canada for actually more than 20 years, but there are still so many questions surrounding it. In fact, it's one of the most common reasons why people reach out to Arthritis Society Canada, because they have questions about medical cannabis and arthritis. So today we are very fortunate to be joined by pharmacist Dr. Rahim Dhalla, who is here to answer many of your questions about medical cannabis. Following tonight's webinar, you'll also have the opportunity to join a virtual information booth where we will have another expert in the field, Dr. Robert Seeley, available to answer any questions that we may not have got to tonight. So you'll be able to access that booth at the end of the seminar at arthritis.ca/booth. Now, before we get started, just a few logistics. First, this webinar is best viewed on a laptop or desktop computer. If you have any technical difficulties, please email arthritistalks@arthritis.ca for assistance. If you have a question for our presenter, you can submit it through the Q&A button at the bottom middle of the screen, please not the chat, and we'll try to get to as many questions as possible during the hour that we have together. You can click on the chat icon in the bottom middle of the screen to access the chat and connect with others, as well as our chat moderator. If you find that distracting, you can close out of it completely. Just click that X icon to close out of the window. And to enable closed captioning, please click on the Show Captioning icon in your controls toolbar at the bottom of the screen. So, many questions that we received in advance followed similar themes, which are here. So we will get to those first before going into the live Q&A at the end of the session. And before we get started, I want to thank our event partners, Pfizer, United Way Winnipeg, and others for their financial support of our Arthritis Talk series. So with all of that, let's get started. And first, a very warm welcome to today's expert, Dr. Rahim Dhalla. Dr. Dhalla, could you start off by speaking a little bit about why some people think that medical cannabis might be suitable for treating their arthritis?
Absolutely. Thank you so much, Arthritis Society, for having me. I'm glad that the Arthritis Society of Canada is, being heard and, talking about medical cannabis, because it's very prevalent now. And, there's a lot of questions to be asked, and let's get right into it. I'm sure many of you heard from your friends, family members, colleagues, cannabis, and this was working well for them. So we'll get into first, what really is cannabis? And, it's one that we've known. The usage of cannabis dates way back, known to use for recreational, medicinal purposes. Even this plant, what I like to call, is a pharmacy in a massive amount of molecules that are in there. We call those cannabinoids or even terpenes. So with all these things working together, it makes for a really highly medicine. The reason why a lot of people think for them is what we have now discovered. We have something called the endocannabinoid system. And I can nerd out on this for about, a solid hour. That's a whole nother lecture, a whole nother system. But really what the endocannabinoid system is in a nutshell is that it's a homeostatic regulator. Which means it's there to protect us. It's there to keep things at normal functionality. This is why it's been implicated in a lot of different disease states like seizure disorder, PTSD, chemo-induced nausea, vomiting, fibromyalgia, inflammation, aka arthritis, even anxiety, things like that. So this is why it's a very robust system, and we're just beginning to learn a lot about it. I want to share with you one of these studies that I did come across. This is a cross-sectional study about they interviewed and asked a survey questions to arthritis patients with arthritis and joint pain. And this is what they found in their survey. There was about 428 respondents. And of these respondents, what they asked was like, how was your pain? 83% had an improvement in pain. 44 of patients reduce their pain by 2.58, which means when someone asks you, what's your pain scale between 1 to 10, it's going to take off maybe 2 points to maybe 3 points off your pain scale. For someone, that could be like day and night, that could be, I can start vacuuming my house again. I can start walking the dog. Like, that could be significant enough to make this a very valuable medicine. A lot of people found they improved function, improved sleep quality. Again, when we're looking at a lot of studies, and I'm probably going to say this over and over and over again, is that we don't have enough data. And the data that we do have is not significant enough to extrapolate on an entire population. So we're starting to gather that now, but these are some good examples of what currently exists. I think a really interesting note for this exploratory study too was almost 20% of patients stopped opioids, which is remarkable because we all know the devastating effects of opioids can have on the body. So a lot of questions come up, like, have you ever talked to your healthcare professional? If that is not available, there's other things that we can go and there's other resources that you can, which we'll discuss later. But also, like, things that you have to ask yourself, have you failed other therapies? Have you tried everything in the book and nothing's still working? Or are you restricted from other therapies, such as like NSAIDs, your Advil, Aleve, naproxen? Some patients are on blood pressure medications. They can't take that. Some patients have had gastrointestinal bleeds. They can no longer take that. So these are kind of some things you would want to ask yourself before even considering medical cannabis.
Thank you, Dr. Dhalla. Maybe I could just pick up on that for 1 second, because we've had a lot of drug interactions and side effects. So of the ones that you just mentioned, Dr. Dhalla, related to naproxen and other things that people should and might have tried before, could you just comment a little bit about, can they then take medical cannabis, or is it still contraindicated?
No, it's actually, what I find in practice is a lot of patients are co-using Advil, Tylenol, and medical cannabis. There's no interaction directly, and we'll get to that. There's a bunch of which drugs can potentially interact. But what I did find, especially as I practice, most patients come in for arthritis. They come in for osteoarthritis. It's literally probably the number one condition why people seek out medical cannabis. Using less Tylenol, they end up using less Advil. So there may be an effect when you start combining it with medical cannabis.
Excellent. Okay, I know we'll get more.
Yeah, sure.
So on this question here, could you start about CBD? We hear a lot about THC. So explain a little bit about what they are. What's the difference between them, please?
For sure. So these are one of the many, like 500 different cannabinoids and molecules. We'll start off with THC. This is probably the most famous. Most people know about this. It is the most abundant cannabinoid that's found in the plant. It's really famous for those people getting stoned or causing the munchies. This is THC. When you're getting to that effect, you're usually using it recreationally because, again, I put a big note in there. You don't need to have high to elicit THC's beneficial effects. So THC, mainly used for pain management, spasticity, especially in MS, seizure disorder. It helps with appetite. So a lot of patients with HIV, AIDS would be using cannabis to help stimulate their appetite and help them eat more. We've now known it's helping with PTSD, can help with insomnia, which, again, we can discuss a little bit, but may have a little double-edged sword because, again, too much THC may actually be negative for REM sleep. Again, a lot of people use this also as an anti-nausea. So it's a really beneficial, molecule. I know a lot of people come in, especially in the pharmacy here, they're like, I don't want THC, I'm scared of it. It's okay. And using it medicinally, we use it at such lower doses than they would be using it recreationally. Some side effects of THC, most notable, dry mouth, dry eye, can cause you to have cognitive impairment. So, being high, or things may sound different, feel different, dizziness, sedation, increased heart rate. And again, that usually depends on the method of how you're using it. And again, we'll get into that on later slides. CBD, on the other hand, it's like yin and yang. You got to think about THC and CBD like yin and yang. CBD is the yin and yang of THC. It's completely opposite in the kind of the effects that it causes. It really is really well tolerated, very minimal side effects with CBD. It is, again, the second most abundant phytocannabinoid found in cannabis. And the reason why CBD got so popular, so famous, is because of seizure disorder. So there's a couple studies, very, very significant effects on reducing seizure disorder in Lennox-Gastaut and Dravet syndrome. These are two very advanced seizures, mainly found in pediatric populations. We now know it can help with pain management. It can help as an anti-inflammatory, may help with insomnia, but on a very different level than you may think of an insomnia type of medication. And it actually may have neuroprotective effects. I made a point there to note that, there's some questions about like dependency and can this be addicting or habit forming? CBD has not shown to be dependent or have any abuse potential. And that's significant because when you're talking about a medicine, you want something that has the least amount of side effects with obviously the most amount of benefit. THC, on the other hand, the yin and yang, THC may actually cause a little bit of dependency. Again, that's usually used when you're using it at very high doses, usually recreationally. When we're talking medicinally, we are using it at a very, very much lower dose. So notable side effects of CBD, but I honestly don't see it that much. Most patients do not complain about it. And again, I have patients from as young as 5, as old as 100 using CBD in some manner. Maybe dry mouth, some dizziness, and some people feel a little bit more tired if they use a high enough dose. Yeah. I know there's a couple of questions too about other cannabinoids, and now that we're in a legalized market, there's all kinds of different things popping up. I wanted to make note of a couple ones that that are starting to creep into the shelves of recreational medicinal stores. CBN. CBN is been widely known for its sedative properties, and I'll tell you the reason why. It's a little bit like THC, but it's not as strong or as potent as THC. So it doesn't attach to the receptor as strong as THC would. So that's why they usually combine CBN with CBD, which helps with managed sleep and insomnia. Another one we've known, CBG, may help with like analgesic properties. So it may help with inflammation, may help with anxiety, depression. CBG is actually made on the flower. It's one of the first cannabinoids made when the plant is growing in the ground, and all the cannabinoids are being produced. So it doesn't have any psychoactive properties like THC does. But what we kind of know now, and these are very early, very preclinical, almost like mouse model and animal model studies, is that it does have potentially beneficial properties. So there's plenty more. There's actually many more cannabinoids. Some of them are not even named yet. And that's how vast and expansive this plant is, which is very exciting to down the road.
So there are now so many ways that we can access cannabis in this country. How can someone safely access medical cannabis?
Yeah, that's a great question. And, I know there's a lot of different recreational stores available on the market. So let's take a kind of a current look at what is going on in the market. So I don't know if any of you have been into a recreational store. Some of them may look real nice and inviting and clean or unique branding. There is a recreational model in which it is open to anybody that over the age of 19, depending on your province. And at these recreational stores, you can find all different types of products, from anything from flour to concentrates to oils, capsules, tablets, you name it, they have it. One big part about the recreational store is that they stipulate a ban on talking about anything therapeutic. And I know there's a question about like, what's the difference between rec and medical? Well, in terms of the products, not much, because they're all made by licensed Health Canada producers. So that means they have a license. They have to adhere to certain regulations. So some of the brands you might find on the recreational side will actually have a medicinal brand that may be named differently. For example, maybe a lot of you heard of Spectrum. Spectrum is their medical side, whereas Tweed is their more recreational side. So again, they're made in the same building. They have different brands associated with them. We'll get into that a little bit later, but what we actually did a study on the on patients with, going to the recreational side. And we went to the bud tenders and we're asking them, like, do you have questions? Do you get medical questions? Do you get patients using this for therapeutic purposes? And, out of all the bud tenders we surveyed across Canada, like, it was an alarming amount that actually, has to sit there every single day and just dodge medical questions. Again, these clerks that work there are not medically trained. And they're not allowed to speak about anything therapeutic. So they may kind of dodge around those type of questions. And like, again, about 87% of the bud tenders were saying that they have questions from patients, or even their doctor told them to go there and get it. So that's kind of like the recreational side. There is a medical model, and the medical model, started almost actually back in 2001 when we actually legalized medical cannabis in Canada. But since 2013, 2014, these are when the big guys started to come and build their facilities. So as of it stands now, it's only online. There's these producers called like Aurora. Some of you may have heard Tilray, Spectrum, the big ones there. So the way it works, you need a prescription. So either you go to your doctor, your nurse practitioner, anyone that can prescribe. They'll give you a prescription. They'll usually send it to one of these licensed producers. Then you'll order online, or you can call their 1-800 number, order, and then they'll ship it to you via mail. I know there's a question like, oh, if I have a prescription, does that mean I can travel anywhere with it? No. Cannabis is not recognized globally as a medicine yet. We're slowly getting there. But as of now, even if you have a prescription, you cannot leave the country with it. So a lot of people ask, again, what's the difference between medical and recreational? I always like to go back to its intention. What's your purpose for using this? Are you trying to treat something? Are you trying to manage your pain? Are you trying to eat more because you have a medical disorder? Or are you just using it socially and just for fun? And that's really what it comes down to. Example of a prescription, and just to kind of go back a little bit, like the way Canada legalized cannabis and the way the Cannabis Act has stipulated the regulations, this is technically not a prescription. It's a medical document, which means it's an authorization for you to possess cannabis for a certain medical purpose. So this is why I know a lot of questions come about, if I get a prescription, is it going to be covered under OHIP? And that answer is no. Again, it's a little too soon within legalization and even within the data set to say that this is a medication. So there is no DIN number associated with medical cannabis. The only ones that have DIN numbers already have been prescriptions for quite some time. And I don't know if some of you may have heard some of them, like Stativex is one of them. Nabilone is another one of them. These are all different DIN number associated cannabis products. Now, there are some insurance providers that may cover it, such as like Green Shield, Canada Life, Sun Life, and the lists vary depending on the insurance. But what I've seen in some of them, like Sun Life, rheumatoid arthritis is starting to be covered. Again, it's not just, I have rheumatoid arthritis, I have a prescription for it now I can get it covered. It's usually more of a case-by-case basis. They want to see that you failed other therapies before starting this. So again, it's still a little choppy within the insurance and coverage world. But again, the more that we talk about it, the more we do sessions like this, the more that more organizations get involved. This is when we start having more of these discussions. What I normally see coverage for in terms of insurance: palliative care, cancer therapy, MS, and seizure disorder. So a lot of these forms, again, you can find it on my website. It's at hybridfarm.com. There's a lot of insurance forms there. You can look at that, talk to your insurance provider, may be helpful in your treatment. That's why, again, like I said, speak with your doctor, rheumatologist, specialist. What I normally, as a pharmacist, I know, like I talk to all kinds of different doctors. What I find the most interesting is that it's the specialists that are very much more inclined to have these discussions. versus family practice. Again, it's very new for them still. I've heard from a lot of patients that they don't want to have these discussions with their doctor. They have fears like they're going to be derostered. They have fears that like the doctor's not going to be open to that discussion. And that's okay. And this is why, there are medical cannabis clinics that exist around the country. And this is how, if you want to use this medicinally, you want to access it safely, search them out. And I've listed some here on the slide that are reputable, it's worth a discussion. And I always say, even as a pharmacist, I want you to have that discussion with your doctor first before we try to help you even further, because everyone needs to start learning about this. It's important. It's an important discussion. And like I said before, all legal products in cannabis, whether it's recreational, whether you go to one of these stores, whether you go to one of the big licensed producers, they all adhere to, at minimum, it's good production practices. So this is why buying it from one of these stores, you're guaranteed to know what's in the package. You're guaranteed to know how much is in the package, and they all comply with the regulations set out by the Cannabis Health Act.
So thank you, Dr. Dhalla. I'm really happy that you covered that piece about coverage, because we've had a lot of questions come up tonight already about, is medical cannabis covered under private plans and public plans? So you've covered that really nicely. I did want to just pick up on one other point, though, that you were talking about there, which is travel, because again, this question about traveling over the border, particularly to the States, has come up. So just to let you answer the question very succinctly, is it legal to move medical cannabis from Canada to the States if you're traveling? And if not, what are your options? Do you have any?
Yeah, that happens a lot. I get a lot of snowbirds. They all go down to Florida or somewhere warm in the winter. You cannot travel to the US with cannabis. And if you go to any airport, there's going to be massive amount of signs saying no cannabis. Because again, it's not federally legal in the States. It's state by state regulated. What I do tell a lot of patients, though, now that you know your dose, now that you're comfortable, knowing what you're taking and knowing the dose of CBD that you're taking, you can, in most states, CBD is legal. It's over the counter. You can find it in pharmacies. You can find it in almost even in gas stations, to be very honest, but I don't recommend you buying it from there. But if you know the dose, then you can seek out some of those things. Again, state by state gets real choppy in the US, because some of them will allow you to get a prescription. Let's say if you're a snowbird, you're staying there for 6 months, some of them will allow you to get a prescription because you have an address there. Some other states will be like, no, you have to be a resident or a US citizen. So again, what I would suggest is don't bring it across the border. You may be caught for trafficking, to be very honest. And again, if you know your dose, then you should try to seek out an appropriate venue such as a pharmacy to get the same product there.
That's great. So that dovetails really nicely into this next question that we have here about if you could elaborate on the safest ways to use medical cannabis, and also how do you know your dose?
Yeah, dosage is always a very interesting question, because again, we don't have the data to support this, but a lot of people, and even doctors, even like, a lot of people and patients, they all think cannabis is still smoked. And that's the big difference between, like, I'd say medical and recreational, is that most medical patients are not using the inhalation route. So either vaporization or smoking, like joints or, bongs, things like that. The safest route, I would say, is non-inhaled format. So oils, capsules, tablets, suppositories, topicals, even gummies. These are all safer versions of using it. And this is what, we're still stuck in that mindset of, like, cannabis prohibition in times where we think we need to smoke it in order to get the beneficial effects. And that's not true at all. And, what we find, actually, I'm going to go back there. There was actually a randomized control trial for a cannabis topical. And again, when we say a lot, like there's these studies, like, the numbers are really small. So this is why a lot of practitioners are hesitant to recommend these things, because again, we don't have the robust data that we wish we had. But in these trials, we did find success. We did find that an application of about 6 milligrams of CBD and THC applied twice a day for a week did have significant effects on improvement in pain and disability. I know a lot of patients say they use their creams. They find is it helpful? Which cream is the best? We don't have that knowledge. And this is more about trial and error. And what I would say is if you're searching out things like topicals, go for something that has CBD in it. I feel like a lot of the industry, a lot of, like the old mindset is like, oh, THC is the one that's most effective. That's not true. The combination is more effective, THC and CBD. But so again, in this study, they used a combination, and they did find that it was helpful. So we hope to see, more data down the line. And again, like when it comes to dosing, it's very variable. And this is the hardest part about medical cannabis is like, what is the right dose? And what I see a lot of questions about what do I take? How much do I take? And when I ask patients, oh, you're already using it. Okay, great. How much are you taking? Oh, just, 1 milliliter, like they're showing me their syringe and be like, oh, 1 milliliter. To me, when I hear that doesn't mean anything because there's so many different concentrations of oil out on the market. There could be a 20 milligram per gram. There could be a 50 milligram per gram, 100 milligram per gram. That all reflects on the concentration of the oil. So a simple way to know if it says 20, 50, 100, 200, 500, this means that each milliliter will contain that amount of product, that amount of CBD. What I normally do with patients, and there's a big caveat in the market: start low, go slow, and that's with any new drug, any type of medication. We always want to use the lowest effective dose. Where I find most patients effective for in terms of dosing, and it really depends on the pain state. Is it fibro? Is it arthritis? Is it cancer pain? It varies. It also varies on the type of what other medications are they on, their age, a lot of different factors. And this is where I wish we had the data to support, okay, we need to take this dose for this condition, and we don't have that yet. But again, where I find, like personally and anecdotally through my practice, anywhere between 25 to 100 milligrams twice a day is where most patients are lying with a CBD, either oil or capsule. Anxiety, again, a little bit different, maybe lower, maybe higher. Sleep, again, it may vary, but I find, and I'll tell you this specifically though, lower doses of CBD may actually be more stimulating. So some patients have come to me and they try to like a 25 milligram or lower. They go, I didn't sleep well. I felt like I had a cup of coffee. So usually, and we have seen some studies on that. We have seen some data to support that higher dosing may be more calming, more relaxing, a little bit more drowsying. So dosing is hard. It is really individual. It is very variable. But these are kind of little tidbits that I wanted to give you that I've seen in my practice. This is a kind of a dosing scheme that most practitioners may find and may have read about, where we usually start with a low dose CBD, escalate it to a certain point, and then we start adding in THC. And that's where I get a lot of questions too, is patients are like, I don't want THC, I don't want THC. And that's great. And nor do I normally start patients on THC. If you've never been exposed to cannabis, we usually start on a CBD, escalate the dose until it's either working or you've reached kind of maximum dosage. And then we start adding in THC. And I'll give you kind of like a reference point. If you're using this medically, if you're using this recreationally, let's say you're having fun and having a little joint with your friends, you're probably intaking anywhere between 100 to 200 milligrams of THC via the lungs. When you're using this medically and you're using this as an oil or a capsule, we're starting at 2.5 milligrams. So it's a very much lower dose. And I know you can't compare inhalation to ingestion because they're very different in the way they work. But it's a good kind of reference point to kind of wrap your head around that the THC dosage is very low. And I'll give you another little tidbit too that I've learned in practice if you've never been exposed to cannabis, if this is like your first time trying it, a 5 milligram dose of THC used orally, so either oil, capsule, tablet, most patients may experience an effect, such as drowsiness, maybe they're a little high. So that's why we start super, super low and then slowly escalate until your body is starting to get used to it. Again, with CBD, there's actually in the Health Canada guidelines, like there was a recommendation about putting CBD over the counter. And in their health expert, they recommended up to 200 milligrams of daily use CBD is considered safe for short-term periods, which is less than 6 months. So knowing that, like most patients are using a lot less than that on a daily basis.
Dr. Dhalla, someone has just asked the question about appreciating everything that you've said about dosing, but is there a maximum dose that we know right now we should not be exceeding?
So CBD, again, no. I would say no to CBD. 200 milligrams daily may be effective enough for most patients. We do see, like in seizure disorder, they're using anywhere between 200 upwards to 1,200 milligrams of CBD. So again, it's all about what is the lowest effective dose for you. We don't know the long-term implications of this. We don't have that data set yet to know that what's 500 milligrams of CBD over 5 years going to do to you and your body. We don't really have that data yet. It is still coming, and then with legalization, this is something we are looking at. I would say with THC, there has been some good studies and good articles and data sets to prove that over 40 milligrams of THC, if that's not working, the risks outweigh the benefit. So you're going to get more side effects than you may achieve with more, reduction in pain or reduction in symptoms. So that's kind of the gauge we're at. And again, most patients are taking no more than 15 milligrams of THC orally. But again, everybody's different.
Okay. Thank you so much for that. And so here, what about side effects? What should people be aware of?
Yeah. So again, this is dose dependent. Notably, I would say in THC, this is what I always counsel patients on. This is what I always tell them. You may experience a dry mouth, dry eye. You may get the munchies. So you may get, very hungry. And that's a very common side effect. May have rapid heart rate. Again, anxiety may come. That's usually it's because of dose. So maybe too high of a dose, or it may be the method. So if you smoke it versus ingest it, that's where you might find differences in the type of side effects. CBD, like I said, again, it's very mild. I don't see too many side effects. Most patients do not complain about any side effects. What we do find notably is drowsiness, dry mouth, and GI upset. So diarrhea, nausea, and usually these are self-limiting. After about a week or so, most patients get used to it. They're no longer having the diarrhea. I'm kind of getting away from more smoking just because, again, I don't really see that too much in the medical side of things. But the risk of side effects are greater when you inhale. So that's why we counsel, most patients are using more capsules, tablets, oils. But yeah, again, like it's very well tolerated. Now THC, like I'm not trying to scare anybody in it, but again, it's dose dependent. But it's kind of like taking, I would like to say Lyrica. Maybe most patients who have fibromyalgia are on some sort of Lyrica or pregabalin. And I don't know if you ever, once you started it, you may feel really drowsy in the beginning, or even gabapentin. You may feel really drowsy in the beginning. But as you start using it, your body starts getting adjusted. And I kind of counsel patients like that with THC as well. So if you've maxed out your CBD dose, we're starting on THC. We started at super low dose. And this is kind of what to expect. And usually we start escalating the dose every couple of weeks, every 1 to 2 weeks, until you're either getting these type of side effects or you're getting positive benefit and symptom management.
Okay, so from your experiences, how will people know if it's working medical cannabis?
Yeah, that's a This is a lot of self-monitoring. And what I tell patients is monitor yourself, monitor how much Advil, Tylenol, other medications are you using? Have you noticed that you don't need to take it as frequently? Have you noticed any reductions in your pain scale? These are some things that you just have to self-monitor. It's hard to know, like, oh, how do I know it's working? Well, again, when you take Tylenol, how do you know it's working? And it's the same concept. And again, CBD at this day and age, again, it really should be over the counter to some degree, where in which patients should be able to self-select it and be able to use it, like in the US. It's because of the safety profile of that CBD possesses. So when we follow up with patients, when I talk to them for like renewals, things like that, I ask them, like, do you find it's helpful? And most of the time it's yes or no. It's black and white. Other times they're like, I don't know, I think it's helping. And again, one big counseling point I always tell patients, especially for pain management, especially for inflammation, arthritis, osteoarthritis, this is not going to work like Tylenol or Advil. It's not going to be immediate. You're not going to feel the effects right away. It does take time for the drug to build up in the system. It does take time to inhibit inflammation. And I usually say around the 2 week to 4 week mark, you're going to notice if it's working or not. And by that, I mean, you're going to notice if you either skip days and you're like, oh, I forgot to take it. You're going to notice that. You're going to notice maybe your pain or symptoms are increasing. You may notice that or you may be noticing that you're using Tylenol more frequently. Where I find the biggest noticeable effects is in patients that are using or other medications with it, and they're reducing it or stopping it altogether. And that's when you know it's working. Again, it's hard to, like, on pain scales, because, this is very subjective, right? Pain is very subjective. It's a very hard condition to treat. And I always like to tell patients, do not expect to go from a 7 on the pain scale to a 0 with this. This is not a magic bullet. This is another tool in your tool belt. But if it does take off a couple points on your pain scale, that's your dose. That's where you stop. That's the most you can expect to get out of it. A lot of people kind of resonate with that, right? So it is a lot of self-monitoring and just kind of knowing when's a good enough dose and when is not.
Mm-hmm. Yeah, that's great framing. And this next one, this is a big one, as I talked about earlier. What about drug interactions people need to be aware of?
Big question. This is what I get every day. This is a big, complicated slide. You don't have to worry about it, but I just wanted to put it there for reference. CBD may interact with medications. And I like this quote. I took this from Dr. Carolyn McCallum and Ethan Russo. It's one of the studies they put out for like practical considerations for medical cannabis administration. Clinically, significant drug interactions are proven rare, and there's no drug that cannot be used with cannabis if necessary. That being said, we do take caution in some drugs that patients are using. So at this point in time, because of the lack of data, drug interactions are more theoretical. So we look at your drug profile. This is what I would do. When you come into the pharmacy, I would look at your drug profile. I would look at what drugs you're currently taking versus what things that are interacting with CBD and or THC, and then I would assess. And that's where I would assess your dose. And these are some notable ones I put on the screen here. But because drug interactions are theoretical, this is where we have to be careful because we don't have robust data on this. I also find that most drug interactions are pharmacodynamic in effect. What I mean by this is that if your drug causes you to have dry mouth, you add in CBD, it's going to cause more dry mouth. They're going to compound each other. So whatever drugs you're taking, it may have an enhanced effect on that. What we do know clinically relevant, clobazam. This is a very common drug used for seizure disorder. CBD can actually inhibit the metabolism of clobazam and increase its levels by up to like almost 500%. So dose reductions are very much needed. If you take, valproic acid, again, another one for mood disorder and things like that, has an increase in liver enzymes. So CBD, again, may have some drug interactions. Most notably, most practically that I see in pharmacy is that most patients are on blood pressure medications. So blood pressure medications, it's not like a harsh interaction, but it's something to counsel patients on. CBD can actually dilate your blood vessels. So it can actually lower your blood pressure, and it's something that you want to be monitoring on a regular basis. Those on blood thinners, again, the one very conclusive that we have is warfarin. Warfarin and CBD may actually increase bleeding. So this is where we are careful in prescribing CBD even at high doses to say this may interact with your blood thinner. Now, I have patients on dabigatran or Plavix that are using CBD, and it's more of a monitoring. So they have to get blood work done. They're monitoring if they're bleeding. So simple things you can do at home. If you're brushing your teeth and you're bleeding, you're having potential interaction. If you have blood in the stool, you may have an interaction. Again, we don't know what dose of CBD causes this kind of inhibition of enzymes that metabolize these drugs. That, again, is data that we would love to have. But we err on the side of caution. So if we don't have the data, healthcare professionals will say, let's err on the side of caution. So again, another really good example is those on anti-rejection meds. They tend to inhibit the same kind of type of enzyme that metabolizes CBD. So what I tell patients, it's theoretically it's possible. I don't want to take that risk. And you may not see the most benefit out of taking CBD, and I don't want to harm what you're currently using. That's why we'd stay away from it. Another interesting point, if you take Cymbalta, a lot of patients use Cymbalta for fibromyalgia, pain management. If you are smoking cannabis, you are going to metabolize this drug so much faster that it will actually lower the amount of drug in your body. Some common ones that patients are using, amitriptyline is one of them. It's typically used for depression, also for pain management. Again, the interaction is more pharmacodynamic, meaning that it's going to cause more dry mouth, potentially more sedation, potentially more lethargy. So caution and monitoring on your part. We had a good question about someone on Xeljanz and some of the anti-rheumatic drugs. Again, we look at which anti-rheumatic are you on. And it's theoretically possible for you to use it. We noticed that there's a potential for CBD to increase Xeljanz effects. So it's a monitoring on your part, on the MD's part. Is it enhancing side effects of your current anti-rheumatic drug? So again, we always err on the side of caution. There's always counseling points that need to be made when you're discussing CBD and or THC with patients.
So thank you for all of that, Dr. Dhalla. I know that many people had questions about specific drugs that you've got listed on your slides. So we will be sharing the slides after the webinar so people can look those up again themselves. This is, I think, another tricky question, but from what you've experienced, does the research about medical cannabis align with what you've seen in practice?
Yes and no. And I'll give you this. This is a very common table of what healthcare professionals may learn about when they're learning about cannabis and doing like extracurricular and continuing education, is the level of evidence and where we stand with the level of evidence. What I see in practice I'll give you the top 3 conditions: anxiety, pain, sleep. And again, those ones, chronic pain is the highest level of evidence we see, but anxiety and sleep, a little bit lower, and especially for osteoarthritis, lower. This is probably why your healthcare professional, your doctor may not be comfortable prescribing this to you, is because we don't have the robust clinical trials that we need in order to make this a commonly used drug. This is why we're not suggesting to use cannabis as a single line method. This is not first line method. This may be a good adjunct to other medications to help have a drug lowering effect, to help cause you to use less medications such as opioids. But as of right now, this is kind of where we stand on with data. So again, I see everything from, Dravet, Lennox-Gastaut, cancer therapy, and these are commonly used, and there's really good evidence to support that. But in terms of like sleep management, some patients can't get to sleep, but some patients can't get to sleep secondary to pain. So we're starting to see this, and we're starting to get more data on this. But in terms of where we stand in practice, where we're at with legalization in Canada, is that there are more patients using it for lower evidence levels of therapy than there are for the higher ones, because obviously the higher level evidence of therapy affects a very small population, right? The chemotherapy induced nausea is not as prevalent as someone with osteoarthritis. So hopefully, more studies come out. I mean, this is what I'm excited for. And
yeah, that's amazing. I don't know if you want to elaborate on that, but maybe we can just jump into some of the questions that we've received tonight, if that's okay with you, Donna.
Yeah, for sure.
Okay, so we've got lots of great questions. We've got to some of them already, but I'll start here. So first question, what you'd be talking about, is it relevant to both osteoarthritis and inflammatory forms of arthritis, or just one or the other?
Both. As of right now, it's both. In the first study that I showed you guys in the slide, where like 66% had a reduction in pain, beneficial outcomes, that was more geared towards osteoarthritis. And again, like you have to take that study as it is, which means that it was patient reported. There was no massive clinical outcomes and things like that. But again, patient reporting data is still important. I like to see it as it's post-marketing data, which is like a clinical trial phase 4, where we unleash a drug on the market, we analyze the data, and this is what comes back. This is what's happening now in the real world. We're starting to see benefit from patients using it for osteoarthritis. And it's because CBD acts as an anti-inflammatory. And that's why when patients come in with like, oh, I have pain, I got into an accident and now this pain is lingering. What I find most effective is that this is more for chronic use pain. So if you just sprained your ankle, like I want to take CBD instead of Tylenol or Advil, I would hesitate to be like, we're not there yet with the data. It's more generally geared towards more chronic inflammatory conditions versus acute inflammatory conditions.
Okay. You talked a little bit about side effects, and people might feel drowsy if they're taking medical cannabis. So a couple of questions have come in here about any implications for driving and or work.
CBD, no. There's been a lot of data, a lot of studies on this. There is no impairing effects with CBD. Now, THC, yes. If you've taken a higher dose THC, let's say 5 milligrams or higher, this is where it can impair driving. Now, when you look on the market and what's available in Canada through the legal stores or the medical stores, what you're going to find is that there is trace amounts of THC, sorry. So that can be anywhere from less than 2 milligrams per milliliter in a CBD ml. So if you take one full ml of a CBD 200, let's say, you may get about 2 milligrams of THC to 200 milligrams of CBD. That level is considered trace amounts, again, not impairing. And this has been shown in many different data and many different studies about driving implications. So now, what healthcare professionals counsel on is if you do take THC, you should not be behind the wheel for at least 6 to 8 hours.
Okay. Next question here about what about weight gain as a potential side effect, and anything you would recommend to mitigate against that?
So again, CBD, I think it has more of a neutral effect on appetite. If anything, it's a reduction in appetite versus an increase. Whereas THC, you will potentially see an increase in appetite. Again, a lot of times I find it's because of the dry mouth, and people want to get rid of that dry mouth, so they start eating things. I'll actually share an interesting study. They did a study in mice and rats about THC and its effect on eating. And they gave the rat either sugary, fun, nice, good food that we all love to crave, and that's why we call it the munchies, versus healthier food. And the rat always chose the munchy food. It always went to that one, which is, I found that really interesting. And it's just because of the way THC affects, there's certain receptors in the brain that tell you to, like, you're even though you've eaten, you're still hungry and you're still craving those things. So it's kind of interesting. But in order to mitigate that, again, maybe lozenges, gum, like keep your mouth a little bit wet, keep it, hydrated, and choose the more healthier snacks, to be very honest. Choose the crunchiness. A lot of patients crave the crunchy when they're on THC, when they get that munchy effect, they crave that crunch. So have carrots instead of chips, right? So there are ways to mitigate that. Just because you take THC doesn't mean you're going to gain weight. It's more about the side effect of THC that causes you to gain that weight.
Okay. This is a good question. Is there a price difference between medical cannabis or recreational cannabis?
Generally not, but again, you have to look at the concentrations that are available. Usually what I find in the recreational stores is lower concentrations of oil. So like, for example, it'll be a 20 milligram per milliliter CBD oil. I think a lot of people have heard of Redican or the raindrops, because I hear that a lot from patients. They usually go up to maybe 20 to 25, maybe 50 milligrams per milliliter. So each ml, each syringe full is 50 milligrams. Now, depending on your dose, depending on how much you're using, you rip through that bottle very fast. What I find on the medical side, you're starting to see higher concentrations available, which brings down the price point of, like, when we look at it, like cents per milligram, it starts to get less when you start getting into the higher ones, and usually more available on the medical markets versus the recreational markets.
Okay. You talked about whether medical cannabis could or could not be covered by private and public health plans. This question, though, is about, can it be claimed on your income tax for income tax purposes as a medical expense?
Yes, it can. So if you do have a prescription from a doctor or healthcare provider, you can, and it's purchased through a licensed producer, so a medical establishment, then you can use those receipts in order to claim against taxes on medical expenses. If you purchase that from a recreational store, they won't recognize that. So the receipts you get from a recreational store, they won't recognize. And it's because the receipts you get from your licensed producer, your LPs, will have their LP license number on there, and they'll have all the different, categories that they require for medical tax purposes.
Okay. A question here, but how do you go about finding a medical cannabis expert or medical cannabis doctor in your area?
That's a good question. There's a couple ones I listed on the slides there. It's usually what I would do is find someone you trust, someone who's had a good experience, and start with your doctor, and they may have good recommendations because they may be in touch with somebody they know of. Again, if you're really scared or hesitant to talk to your doctor about that, then there are some licensed producers that may help you get set up with a reputable company and reputable, healthcare professional that can do that.
And a follow-on question: once you find a licensed producer, the question is about, are there any clinical supports typically that can help guide patients through the process, nurse practitioners or other people like that, that can help people as they're trying medical cannabis?
So usually, like, again, a lot of these clinics are all online too. So what I would say is, like, the person that's educating you, they should be, a healthcare provider that will help you guide through that process. And what I've heard mixed reviews from the industry, right? Like there's definitely some clinics that just sign and go, versus other ones that are really more hands-on. So it's about searching them out and getting good recommendations either from your doctor or family member that's already been using cannabis to find that. But a proper healthcare provider for medical cannabis should and will be able to provide you that ongoing support. And that's what we do. I mean, that's what I do at my pharmacy. That's what people pick up the phone and call. I'm like, hey, Rahim, I just started this new, med. Can I take it? What do I do? Like, and it's just, that's unfortunately, that's how it should be in the country, but it's more recreationally recognized than it is medically at this point.
That's great. So you referenced a number of great studies. So someone's asked a question here about, can you just clarify, are these what we would call clinical studies that are valid? Like how would you classify the studies that we've talked about that describe what we know right now?
There are some of them, like the one for topical, let's say, like that was a randomized control trial. So RCTs are, I guess, the mainstay, the golden goose of trials and studies, because it provides a direct effect. We know that if you're comparing this to placebo, it's a direct effect. This is beneficial. So some of the studies that I listed in there, some of them were randomized control trials. Some of them were crossover studies, like the one I presented in the beginning. That was more of a survey to patients. So again, we have to take all this into consideration when we're analyzing how effective this can or can't be and kind of make our own judgment about it at this point. Unfortunately, we don't have enough robust studies to show its efficacy with arthritis, for example. We do have there's some really good randomized control trials that are available for seizure disorder. And this is literally, it was in the New England Journal of Medicine for the seizure disorder for Lennox-Gastaut and Dravet syndrome. And this is where it was clinically significant in the sense that 80% of the patients that were taking this ended up having a reduction in seizures by a significant amount. That's what got CBD famous. And then after that, we started seeing more outcomes with what CBD can treat. So it was a mix. What I presented to you guys was a mix of different studies. So some of them are cohorts, some of them are randomized control trials. That's what we have to go with right now. And again, I know that there was a question earlier too that I may not have got to, but a lot of people are asking about, the CBN and CBG and all these new products that are on the market. What we know is more animal-based studies. So we don't know if it's clinically relevant at this point. And then even though the products are on the market yet, we don't know what the dosage should be for these things. But at the same time, we have a baseline idea of what it may or may not do.
Excellent. I think I have time to just squeeze in one last question for you, which is, if somebody is just thinking about medical cannabis, never tried it before, where should they start? What's the first thing they should do?
Have a conversation with your doctor. Help them out. Like, again, a lot of them are educated. Again, pharmacists are educated as well. Most pharmacists in Ontario, at least, we had to take a cannabis course in order to renew our license back in 2021, 22, around there. So again, they may have good resources for you. Again, you can always reach out to myself. I'm available. It's tough because, again, I'll tell you not to go to Dr. Google. Dr. Google, there's all kinds of stuff on that internet, and it's a lot of conflicting things on there. So again, I would reach out to cannabis clinics or your healthcare provider as a really good starting point, and they should be able to point you in the right direction as well.
Amazing. Okay, thank you so much, Rahim, again, for sharing all of your knowledge with us today. We just want to take a moment to get the audience's feedback on today's presentation. So those of you who are watching on Zoom, you should see a poll question pop up on your screen with some answer options. So obviously click on the response that reflects your thoughts. I feel more knowledgeable and empowered after attending the webinar. Tell us what you think. We will also be sending you an evaluation form when we email the recording and the slides. So if you weren't able to access that poll question, you'll have the opportunity to give us feedback then. And we really do use this survey feedback to shape our future arthritis talks, and we really, really do value your input. So thanks in advance. And then once again, we are grateful to Pfizer, United Way Winnipeg, and others for their financial support of this event. We will be concluding the Arthritis Talks portion of the webinar momentarily. But we do encourage you to visit the virtual information booth immediately following the webinar, where Dr. Robert Seeley will be available to answer more of your questions about medical cannabis and also share how he's used it with his patients. So to join the booth, visit arthritis.ca/booth or just click on the link that's in the chat now. So this concludes tonight's Arthritis Talks. On behalf of all of us, thank you so much for joining us today, and please do stay well.